In healthcare, financial stability is the bedrock of patient care, yet it's more intricate than ever. But what if the key to saving millions came not from a medical journal, but from a big box retailer? This isn't a fluke. It's about looking where others don't, at the significant spending in non-clinical costs. This reveals a seismic shift. The healthcare CFO is no longer just a financial steward, but a strategic visionary. We'll break down how this new breed of CFO drives success, from mastering operations to shaping the future of care. So, what defines this strategic shift? It starts with recognizing the CFO's expanding influence beyond the numbers. The data shows this evolution is already here. 41% of healthcare CFOs now dedicate most of their time to strategic, non-financial duties. They are no longer just chasing patient volume. Their primary focus is guiding the organization to sustainable cost efficiency and value. The alternative is dangerous. Many struggling hospitals face failure not from a lack of patience, but from a lack of proactive financial strategy. This strategic mindset translates into concrete operational mastery. It begins with a foundation of rigorous, intelligent compliance. Proactive CFOs build compliance directly into their budgets. This transforms audits from a painful necessity into a simple verification. They don't just hope for compliance, they measure it. Key metrics include targeting claims denial rates below 5% and monitoring ethics hotline usage. But the healthcare environment changes too fast for old tools. That's why the rigid annual budget is dying, replaced by adaptive methods. Methods like rolling forecasts provide a real-time, adaptable financial picture, allowing organizations to pivot quickly to new challenges. With a modern strategic framework in place, where do CFOs find the most impactful savings? It's about finding hidden value in plain sight. First, they master payer contracts. Actively renegotiating rates and hunting for underpayments can drastically boost revenue. Second, they scrutinize every bill. One group saves significantly on prescriptions by repricing out of network claims and finding overcharges. Finally, these savings aren't just for the bottom line. They are strategically funneled back into clinical environments to support staff. This raises a critical question. Can a CFO's financial acumen actually be measured in patient satisfaction? But achieving this synergy is incredibly difficult. The role is under immense pressure from forces reshaping the entire industry. The proof is in the turnover rate. Since 2020, 71% of healthcare CFOs have left their positions, a rate far higher than in other sectors. A key driver of this pressure is the unstoppable shift to value-based care. This isn't a future trend, it's the present reality. With over 60% of Medicare payments tied to outcomes, old financial models are obsolete. Profit is now directly linked to patient health. So how do the best CFOs manage this difficult situation and thrive? They connect the dots between strategy, technology, and patient care. Remember those hidden operational costs and difficult revenue cycles? Top CFOs are now deploying AI and automation to tackle them. This isn't just about efficiency. By automating the back office, they free up critical capital for the clinical improvements needed to win. And that brings us back to our question. Absolutely. Hospitals with top quartile patient experience scores have net margins more than double those at the bottom. This isn't a correlation, it's a cause and effect loop driven by strategic finance. Financial health doesn't just follow patient care, it enables it. We've seen the shift to strategic partner and how they find hidden value. So, what does this mean for your organization? It means elite financial leadership is no longer optional. It's a core competitive advantage where financial success and patient outcomes are intertwined. For many organizations, a full-time executive of this caliber is out of reach. This is where fractional CFO services provide a powerful alternative. They offer access to top-tier strategic guidance and operational execution at a fraction of the cost, making elite financial leadership accessible. Whether full-time or fractional, the mandate is clear. The modern healthcare CFO doesn't just count the resources, they multiply their impact. Because in healthcare, every dollar saved is a dollar that can be reinvested into the true bottom line, a healthier community. Is your financial leadership built for the future of healthcare? Assess your strategy today.